Well, good morning. I'm Mark Newsom, and I'll be your moderator for this particular segment with my esteemed colleagues here on this morning. We're here to talk to you a little bit about transformative possibilities of artificial intelligence and generative artificial intelligence. Its value in productivity, its value in innovation in the healthcare industry, and the critical need for policy, regulation that will help to ensure that it's being deployed safe, effective, and ethically. Neil Blomkamp, in his 2023 movie Elysium, and some of those of you who may have seen that, or 2013 movie Elysium, had Matt Damon and Jodie Foster. The year is 2154. There is Earth. And then there's this space station with a place called Elysium, where there's no crime, there's no illness, and everybody has a pool. Illness is addressed by this advanced technology called medbay, where citizens simply mediate their own care. Yes, patient-centered care, patient-mediated care. And my thoughts is that medbay had to have some generative AI in it for it to be able to do all of these assessments and treat. Simply by living or lying on the medbay, they could receive care. It had the data, it had the diagnosis, and it had the cure instantaneously. In a 2016 article by David Gray, he reflects on Elysium and its treatment inside the medtech sector. He observes, one size fits all cure for any element existed in the movie. If you're fortunate enough to live on Elysium, however, there are no hospitals. Every citizen simply has access to the superfast medbay dotted around the planet. There seems to be no limit as to what the medbays can cure. Inside the movie, you see things like radiation poisoning being cured, acute lymphoblastic leukemia, and even facial reconstruction. Far-fetched, you ask? I would say to you that Bernard Marr in 2023 had a Forbes article by some of the juggernauts inside of this AI and generative AI industry. And here are some of the things that they said. We will have for the first time something smarter than the smartest human. Elon Musk. I think AI is going to be the greatest force for economic empowerment of a lot of people getting rich we have ever seen. Sam Altman, OpenAI. The analogy is similar to move from mainframe computers to large machines to laptops. Lorena Lee, senior partner at McKinsey. I would argue in the long term, failure to embrace and utilize AI may result in a lawyer not being the best and most competent advocate for their client. Michael Szymanczyk, California Innocence Project. Giving the Elysium analogy and some very provocative comments from some very significant people in this space, and given some estimate, generative AI will be in the trillions of dollars. I challenge you today to consider a few questions as you listen to this esteemed panel. What does it mean in the hands of the consumer, in the hands of the provider, in the hands of the payer, and in the hands of the regulator? How will self-diagnosis look to that consumer, that patient? How will operations and diagnosis and treatments look to that provider? How will payers perform their operations better? How will they risk stratify their business better? And how will regulators focus on equity, access, and safety? With that, let's meet our panel. We have Quimby Kaiser, a principal in federal advisory at KPMG. We have LaQuandra Nesbitt, Dr. LaQuandra Nesbitt, senior associate dean, the bicentennial endowed professor here at George Washington School of Medicine and Health Sciences. And we have Andrew Amidvar, MBA, PhD, Vice President of Government R&D at Philips. Thank you for being here today and for joining me on this stage inside of this panel. My first question here is around AI's role in transforming human work. In what ways is AI reshaping professional roles in healthcare? And how can we ensure a harmonious integration of AI that enhances human work rather than replacing it? Quimby?
Well, I think we've heard a lot already today about what the advancements in AI can be and thinking about what the possibilities in healthcare. And I think Dr. Nesbitt will have some wonderful ideas about what that would entail, whether that is using the auditory capabilities or the visual capabilities of AI. It's pervasive. And I think what we have seen from a healthcare adoption perspective is really breaking down the walls behind the back office, the middle office, and the front office, to really think about how AI is going to just fundamentally change the way work is done. And so when you think about the chasm, there's these great possibilities that leaders see with AI, but we know that employees and Americans, I think one statistic I saw is that Americans, about 13% see the benefit of AI, only, and the rest don't see the benefit yet. There's a lot of skepticism in the environment. And so leaders have a chasm between what's possible with AI and the reality of skepticism with employees. And so the transformation is real, the chasm is real, and adoption is low. And so I think when you think about having humans adopting AI and bridging that gap, leaders really have a fundamental opportunity to build that trust, rebuild that foundation with their employee base to take advantage of these technologies that are available to them.
Absolutely. And certainly in the back office and front office operations, we can certainly deploy it at high scale. Andrew, how about in the R&D field? How do you see that playing out?
So what has happened in AI? AI has been around, somebody said it's 65 years. And I'm one of the few people who was involved in the first phase of the AI.
Are you dating yourself here, Andrew?
Yes, we actually. So I think what the AI has today, the first wave of AI was in automation and robotics. It's already happened. And remember at that time they said everybody is going to be out of job, all the factories. And the second wave is natural language. For those of you who remember, there was a software called Dragon Naturally Speaking.
That's right.
And how unnatural that speaking was. So basically, if you look at it, compare it to ChatGPT today, you can interact with normal natural language and the third phase that I think it's going to be in the future, and it's subject of R&D, is predictive analytics. Predicting things like from the maintenance of a dishwashing machine in somebody's house to an MRI system that could malfunction or could not operate right or need maintenance or need update. So I think that third wave is the subject of most of the R&D work, and that is going to be the future of AI.
Thank you for that. If we move on to this ethical governance idea in AI-driven healthcare, ethics in AI healthcare is not just a topic, but it's a saga of ongoing dialogues and decisions that are occurring. So Dr. Nesbitt, can you tell us how can ethical governance models in AI-driven healthcare balance patient welfare and privacy with the need for innovation? And any stories that you can have to share with us?
Yeah, so one of my favorite things to talk about is governance. Big shock there. I spent about 20 years of my life in governmental health organizations, spending a lot of time governing health professionals and healthcare organizations and things of that nature. And we would often see that things were ripe for innovation, but we would often forget to talk about the governance of those things and the policies that needed to be in place And when we were being mindful of the need to have a governance structure in place, then the innovators would get very upset because they felt like we were slowing them down. In the space of AI, artificial intelligence, and the things that I am most optimistic about is what was mentioned last, is that third phase of predictive analytics, where I think there's tremendous opportunity to improve health outcomes, is who we include in the conversation around AI and the implementation of AI anywhere in the health or healthcare delivery system or health payer conversation. And good governance means that we're always thinking about not only the entities that are going to be implementing AI, doing R&D, the healthcare organizations, the back house, but who ultimately will benefit, and that's the patient or the client. And being mindful of where harm may occur. So is there risk of harm, being violation of their privacy? How will their data be used if their data is being used to generate the intelligence that goes into artificial intelligence? How will their toolkits be developed? Are they really being done to the benefit of the patient? Is it meeting its intended use? And having them being part of that conversation or that governance ecosystem really helps us always be mindful around the ethics of AI. In the same way, if an organization is creating AI tools, being mindful in that organization, is it creating harm? If we're talking about the utilization of AI tools because we want to find out, are patients getting the right care, the right amount, utilizing the right amount of care, et cetera, how do we trigger our AI systems to be able to find bias? How do we make sure that our AI tools are meeting their full potential or doing what we designed them to do? You have to set up governance structures to be able to do that. And governance has to be at every level, right? So governance within the organization, governance for the people who are paying for these AI tools to be used, if they're replacing human work, all of those types of things. I think it's very important for us to be mindful of that every step of the way as AI becomes a bigger and bigger part of our healthcare system.
So then you're saying the responsibility belies both regulators all the way down to the consumers, to the technology companies.
Absolutely, absolutely. And for me, when you talk about governance and these shared governance models, governance isn't just about having a regulatory policy or a law, right? You can create a governance board within your organization to have shared governance around the development of these tools. And if we do that well, we don't end up with the type of overly restricted governance on the legislative or regulatory and policy side that often can squelch good innovation.
That's right.
It's important to have the different voices also being heard as well, right? Whether it's cybersecurity or the risks and the benefits, and measuring the benefits and getting that feedback loop. Governance sounds heavy always, right? It sounds, in many cases, unnecessary, right? People are like, oh, you know, this is the Wild West. We're just going to go, go, go. The governance is what makes it digestible. Right, the governance is, especially I think with the pervasiveness of AI and it's so accessible, it also allows the flexibility, that nimbleness to pivot too. And if you don't have the voices in the room, if you don't have the mechanisms to share those ideas, to learn together, you miss out. You really, well, or you get yourself in trouble. Yeah.
That's right. So it can go too far, right? In terms of it's sort of in a position always trying to keep up with technology moving so fast, so it can go too far. Andrew, you had something on it?
National Academy of Medicine actually has a steering committee on AI ethics. And the reason I know that, our CEO, Roy Yacoub, is the co-chair of that steering committee. So to credit to them that they already thinking about this, and as Dr. Nesbitt said, probably transparency is an important story as far as how you trained your algorithm, how you tested your algorithm, what kind of data you used, was there any bias, was it inclusive, not inclusive, etc., can impact the ethics of what we do from the government, from the private industry, and nonprofit as well.
Absolutely. And I've got a question here from the audience, and this is one of those zingers. So I'm going to start with you, Andrew. And the question from this anonymous individual, we'll say, do you worry that AI will exacerbate racial bias in healthcare or help alleviate it? Does it depend on the training data?
Yeah, somebody said the future is here, but unfortunately not evenly distributed. And that is actually the story of that, because most of Dr. Nesbitt would know that most of the clinical trials candidate are selected not very inclusive. Mm-hmm. And not that the pharmaceutical or the medical device industry are not trying. It is difficult, and it is selecting subject is a complex task. In fact, this is one of those areas that AI can help and create an inclusive cohort that has all type of ethnicity, all type of genetic makeup, all type of different kind of subject to make the data collected for the training and testing of the algorithm to become the AI product more inclusive and not having biases in it. And that is probably an area which is ripe for investment to create AI models that can select the right type of subject.
That's right.
And the right type means all type, not just one type.
That's right. Well, thanks for that segue. I'll pay you afterwards for right into our next question. AI in enhancing health equity. And Dr. Nesbitt, I'm going to go to you. How is AI being leveraged to improve accessibility to healthcare services, especially in the underserved regions? And what role does it play in enhancing the overall efficiency of the healthcare delivery system?
Yeah, I think that's a tough question because it hasn't begun to even remotely achieve its potential in that space, right? And a lot of that is because we have still significant access to care issues for populations. And when we talk about equity, we're talking about geographic inequities, right, where we have still rural communities and even within urban access to care inequities. We have low income versus high income access to care challenges. And then we have racial and ethnic healthcare access to care inequities. And I'm focusing on the access to care piece because oftentimes when we train these algorithms or we create these AI algorithms to develop them, we look at administrative data, which is around healthcare utilization. And it's going to undercount the actual need for care unless you adjust the models and the way that you're training them. So if you don't have in your governance structure the right people on the team, I knew that was going to happen. The right people on the team, then you end up with a model that is flawed. And so your artificial intelligence or your AI model is not intelligent, right? So the only way that you can really begin to address healthcare disparities or health disparities, health inequities using AI is to make sure that you have good data that you're training the models on in the first place. Once you do that, you can begin to build toolkits that help navigate people into the right systems of care. And that can help to mitigate some of the workforce challenges that you have in many of these communities. That helps you be able to get people into the right places at the right time, whether it be a consumer-facing interface that helps them be able to interact with a tool that says, this is where you need to go, this is when you need to go there, and it mitigates a lot of the many challenges that we already have in the system. So there's a tremendous opportunity to be able to address healthcare inequities and health inequities using AI, but we have to make sure that we're building these tools using the right data and adjusting for underutilization of healthcare at the beginning.
I'm going to owe you lunch after this, too, because you just described the movie Elysium. And so I know the count is going to go up. Everybody's going to go out and watch the movie Elysium. You know, the haves and the have-nots, right? And the equity that was or was not there. You just described it perfectly. Quimby?
I was just going to add, too, in order to do that, you also need the infrastructure and those, so broadband and access to the internet. And, there's ways to reach people, wellness, right? Just getting people to be mindful of what they're doing, having that basic infrastructure, I think, is a basic building block as well.
And if I could extend that on out a little bit, Quimby, can you share with us how AI chatbots and assistants are being used to improve, the patient-provider relationship?
Well, I think we're all getting familiar with chatbots, and it gives patients and people who are interacting with the health system an opportunity to get information. I was just looking at a case study where there's a kind of a buddy bear that is utilized. Are you familiar? So, and it's for pediatrics, right? For pediatrics that are I think in this particular case, leukemia, right? So really difficult disease, difficult to understand. Parents are under stress. The kids are reflecting the parents' stress. But, Buddy the bear can talk to the child and record what it says and interact and to help meet the patient where they're at in a way that is very personalized, which I think is the kind of the holy grail, right, of medical care. But using AI as a way to unlock that. Now, the person I was talking to said, well, wouldn't that be great then if the medical staff had access to that information as well, because then they could, use it, right, and help with that situation. So the use cases are incredible, right, in order to support people in having, not in a scary, like I'm going to take care of my own medical care, right, not taking it out of the hands of the doctors, but augmenting that is exciting because it's complicated. It's, as we all know, since we interact with the healthcare system ourselves.
Absolutely. Thanks for that. And I'm going to boomerang back to you, Andrew, because you started out on predictive analytics. And let me ask a question around that, specifically as it relates to health outcomes. And part of my avocation is adjunct professor here at GWU. And I instruct the students that we're always focusing on health outcomes in the healthcare system, a system of health instead of a healthcare system. So how are advancements in AI-driven predictive analytics transforming the way that healthcare professionals anticipate and manage health risks and outcomes?
So with the help of AI, it is possible to create more access to care with remote patient monitoring and telehealth, virtual health, and all of that. And by the way, as far as the diversity of things, we have laboratory. We generate our own AI. We use our own AI mostly to make things, what we call it, to help in decision support system. We don't use AI to do diagnosis. We use AI to do collection of data, analysis of data, all of that, but in support of decision support system made by a physician. So I want to be careful. We use the AI as assist, not as AI as a substitute. So that's step number one. Step number two, I think one of the area that can help the patient outcome is being able to monitor patient in remote area and calling the ambulance before the patient knowing the patient needs the ambulance. See, this is something AI can do. For example, readmission is a major problem for major hospitals. Predicting readmission rate, predicting the discharge, the time of discharge. The insurance companies want the patient to get out of the hospital as quick as possible, so as the hospital. So AI can predict the risk of releasing this patient 24 hours early. It could create a readmission problem, and therefore AI as a whole can help the clinical workflow to work better, to be more efficient, to be more predictive than just making a decision different by human. So suggestion is that the AI can help human to make better decision in the health outcome of the patient. Of course, patient safety, patient privacy, all of that was part of the AI capability that can be added, and it doesn't exist today. It is, I mean, I don't know how many of you received a letter that from your insurance, our company got hacked and all of your information is gone. By the way, call Experian to tell them to do X, Y, Z. So I think, so AI can sort of help to prevent that kind of event as far as the patient privacy, security, safety, and also the outcome.
Excellent, excellent. And Dr. Nesbitt, the same question to you.
Sure. I think some of you may recall a period of time not too long ago where we were involved in this public health emergency. And during that public health emergency, some of us use these tools for predictive analytics to be able to think about, again, not for the individual diagnosis, but how we may need to plan for the utilization of healthcare facilities or need to plan for the need for additional healthcare resources, whether it be human resources in our healthcare workforce or the need to build additional capacity in our healthcare facilities. And we used a number of models in predictive analytics around when we may need surge capacity in our healthcare facilities and looking at diagnoses trends or who was getting sick and where they were getting sick and whether or not we would need more capacity in intensive care units versus overall hospital beds. Would these be pediatric beds versus adult beds? When we may need the threshold for using an alternative care site. All of these things become extremely important. And I think that demonstration of how this data around we were using like SEER models, SEIR, suspected, exposed, infected, and recovered individuals. We were using those types of predictive and analytic models. And then people got really excited about the potential for predictive analytics to be applied to other things in healthcare. And recognizing how they could be a part of healthcare planning in a much more dynamic way, as opposed to this very rudimentary thing that we were doing before, where we would cold call you on the phone and ask you, did you have this particular health condition? Yes, no, and say, oh, this is the prevalence of this condition in our population, right? And that's where it would begin and end. But once people got familiar with how this work was being done around COVID, for us to be able to predict into the future and adjust those models on a weekly basis, then people really saw the potential in how you could use this data, and it had a really good accuracy in certain communities where you had real data scientists doing this work for you and working with clinicians and people who had real understanding of healthcare systems and healthcare dynamics working together as a team. So the potential here is great. And I think that as Quimby mentioned, we have to have this conversation where we're not always looking at the harms, where we're looking at the benefits as well, and keeping the public, the ultimate end user and end beneficiary of AI, abreast as to why this is so beneficial and we should move forward.
Quimby?
I was listening to a TED Talk, and they were talking about the visual AI and the accuracy of the retinal scans, and that the AI now, a human can only deduce whether it's male or female person 50% of the time, but AI 97%, and they're getting better and better. And the list of predictive diseases that you can now, at least from a research perspective, get from a retina is pretty astounding. So I think it was the keynote was said, I think a lot of people raised their hands that they wanted to know if they were going to have a health issue in the future. Using AI and using AI predictively, I feel like we're just sort of on the cusp of having the ability to I don't want to say read the future, but certainly have a much better idea of the things that we might have to have, might need to manage from our own health, perspective as well. It's very exciting.
So let's extend that just a little bit, because I got two questions here from the audience. One is on preventative care, and the other is on diabetic care. So can you talk to it through the lens of that? And then maybe Dr. Nesbitt as well.
It was diabetic and
Preventive care.
preventive care. I've got my Oura ring. I think you've got one too. When you think about health and you think about wellness, I feel like that's an area that people aren't talking about as much. Like, we're so excited about treating the disease, and there's so much potential. I can't remember what the statistic was, but a huge amount of people want their doctors to have this information, right? So that it's available, right? But you need help, bringing that all together and helping any human to digest that. So the opportunity to use data, wearables, supporting everyday life. My father has multiple issues. One is, diabetes as well. Technology has helped us manage, his health at home in a way that I couldn't even imagine, 5 years ago. So, that whole wellness and the whole using technology even outside of the clinical setting, I don't know, at home, I think is honestly probably has as much potential as, the clinical setting as well.
Excellent. Thank you. Dr. Nesbitt, you got 30 seconds on it?
Yeah, the challenge here, though, is that our data is still in so many disparate systems, is that it makes it very complicated for us when we talk about population health, which is the space I'm in, is that the population's data is in too many disparate systems to get a good marriage between where a lot of our data of interest sits versus our clinical data and where our health is being managed by a clinician, right? So it makes it difficult for us to get a good sense of where our wellness information sits versus our clinical health information. So we got to close that chasm a little bit.
Back to data.
So thank you. So speed round. Future of AI in medicine, looking ahead. What are the storylines, right? So 30 seconds each. How do we keep this from being the next WebMD and folks self-diagnosing and then coming to tell a doctor what they should be doing to them? Andrew.
There was a reason I suggested we are using AI as assist, not a substitute for diagnostic. Any time that you are dealing with complex data and human biometric, human vital sign, you can collect something like 164 of them. That you are dealing with a complex data. The AI can help with that. And imagine you go to your physician, and instead of doing a spot check, they are going to see 6 months of your data all on the screen, and they can do a better preventive maintenance, et cetera, et cetera.
Absolutely. Dr. Nesbitt?
I would say inclusive and shared governance of AI as it's being developed, and then as the AI tools that are part of the healthcare system and health system being developed as, again, he mentioned assistive tools and not supplemental or replacement tools, I guess, to the clinical team.
Absolutely. Quimby?
I'm going to go back to not forgetting the human in all of this, right? Bringing it back to people who together are exploring and being agile, learning together and failing together is just, I think, critical for the benefits of AI to be adopted. If the human is resistant, if the human is overwhelmed, it takes time to do these things. I don't know about you all, but I'm exhausted every day because of all the changes that are going on. We're inundated with information. It really is incumbent on organizations and leaders to embrace the emotional part of these changes and support the human in the adoption of the technologies.
Excellent. So I'm going to land this plane perfectly on time here. So hopefully we shared something with you that piqued your interest. And the question always is, what will happen when the progress of technology collides with the societal evolution as they understand and we all get our minds around this generative AI. Thank you for your time, and thank you for this team up here to share the stage with me today. Thank you all.
Thank you.